Good morning, everyone, and welcome to our final Security Health Plan Academy webinar of the year. Today's session will provide an overview of the importance of medication adherence and introduce two no-cost services available to Security Health Plan members to assist with adherence: RX Saving Solutions and Medication Therapy Management. We are fortunate to have two returning guest presenters from our pharmacy department to speak with us on our December topic: clinical pharmacy specialists Amanda Siegler and Kurt Wittig. Amanda attended pharmacy school at the University of Wisconsin-Madison and completed her residency in Minnesota. She has been with Security Health Plan for 5 years. She is dedicated to helping our members manage their medications. And Kurt graduated from pharmacy school at the University of Wyoming and completed his residency here at Marshfield Clinic. Since then, he has worked at Security Health Plan and focuses on assisting Medicare members with their medication management. Before I hand over the floor, I just want to express our sincere gratitude to everyone who supports this series. Whether you join us for the live events, submit questions for our presenters to respond to, or watch the webinars at a later date, we're constantly amazed by our audience's engagement, and we look forward to continuing the health and wellness series into next year. So without further ado, Amanda and Kurt, you're welcome to begin.
Thank you. So good morning, everyone. So today we'll be starting here on talking about medication adherence. I've got a few slides here on that. So we'll go ahead and get started. So what is medication adherence? And so really that just means taking your medications as your doctor had prescribed. So taking the right dose at the right time and the right frequency. And this is important because sometimes, if you stray away from how a medication is intended to be taken, this can lead to increased office visits and sometimes even put folks in the hospital. And so some common reasons that we see that patients are not taking their medications are maybe just not understanding them, the directions correctly, forgetting to take them, especially when you get to have multiple medications on board. That can sometimes lead to, how will I fit this into my day and my routine? And another one that we sometimes hear about in our visits with patients are, due to side effects. So each med can potentially have side effects, and that's something that we hear about quite frequently. And then sometimes it's just due to cost. Sometimes people will be prescribed a medication and maybe there's not a generic available yet, so they're expensive. And so that's, something that we can always help with here at Security Health Plan. So I have a few stats here on the screen just in regards to adherence, just for your reference there. And so, what are some strategies that we recommend sometimes to help with adherence? So I have these on the screen in case that is helpful to you. One recommendation that we find works quite well is organizing your weekly meds in a medication box. And especially if you have, multiple times a day that you have to take it, they do make pill boxes that have morning, afternoon, and evening slots. So that can be helpful, if you're on multiple medications and you need help organizing them. And those are actually available at a lot of local drugstores, and even if you have access to our over-the-counter benefit, I believe we still have the medication boxes in our over-the-counter catalog. Other recommendations to help take meds on time can be setting an alarm on your phone or another alarm that you might have, posting some reminders where you'll see them, keeping them in a place that you'll see them. You want to just keep in mind that you want to still keep them out of reach of any kids or pets that might have access or try to get into them, you still want to keep safe storage in mind. Other strategies that we have sometimes is if you're only taking a medication once a week or once a month, making a note on your calendar can be helpful. And then other strategies, if your plan allows more than a 30-day fill, a lot of our plans do allow for at least a 90-day supply of a medication. That can help decrease trips to the pharmacy, and then also making sure that you have enough for the months to come. So just a few tips here to keep in mind with that, just to help take meds on time. And this is always something that we can help with too, if you meet with one of our pharmacists at Security Health Plan. So the next part of our presentation, we're going to dive into two services that we offer to help patients at Security Health Plan. And these services can help with cost, adherence, getting questions answered. So we're hoping to just provide a brief overview today so that everyone has an understanding of what options are available. So the first one that we'll touch on will be the medication therapy management service. And then the second one will be the RX saving solutions. And so then I'm going to pass the next part off to my colleague, Kurt, to tell you a little bit more about our MTM service.
Thanks, Amanda. As Amanda mentioned, the first program that we're going to talk about today is MTM, or medication therapy management services. So what is medication therapy management, or MTM for short? It's a program where specially trained pharmacists identify high-risk patients, and the goal to help them save money, address safety concerns such as drug interactions, and ensure people are on the right medications at the right dose, and ultimately with the goal to help improve their quality of life. So on the screen here, we just have general flow of the process. So first, it's going to be a discussion over the phone. Typically, sometimes we have opportunities for face-to-face visits, but those are more rare nowadays. So mostly it's telephonic or telehealth. So we review all medications, including over-the-counter OTC products. It's key to include OTC products because these can have effects on certain disease states or potentially interact with some of your prescription medication. So it's good to have knowledge of all these products and medication that you're taking. And then we start the process with identifying duplications. So you're taking two medications that do the same thing and might not need to be on both of them, any potential conflicts or other safety concerns. And also looking at drug interactions. So prescription medications can interact as well, along with over-the-counter products. And then we also look at potential dose changes to your medicines. So depending on how well the kidneys or liver are working, different doses of certain medicines are recommended to help decrease the risk of side effects. And then another key component of this, as Amanda kind of touched on already, is looking at adherence. So we address medication schedules and identify missed doses, if any, and potentially helping to address why. So if it's forgetfulness, cost, side effects, or anything like that, we can try to help address that situation. Then after the conversation with the patient, there's a medication action plan and a personal medication list are created after the visit. We have some examples of these later on that you'll be able to see what those look like. And these are a summary of what was talked about with the pharmacist and a complete medication list to have available on hand if needed in the future. And the medication action plan includes information on everything discussed from medications to vaccines. And then lastly, with your permission, we'll outreach the provider, or prescriber, or any other healthcare member of your team to address any of the potential issues that were identified earlier in the visit. So what are the benefits of MTM? So firstly, they empower patients. So encourage patients to be active participants in their healthcare, empower them to be more knowledgeable about and responsible for their health and medication use. We also help facilitate a more effective partnership among patients, their pharmacists, physicians, and other healthcare providers to help achieve optimum medication therapy results, because each of these players play a key role in making sure medications are effective and working well for you. Also helps provide value. by contributing to safe, appropriate, and effective use of medications, so that can help improve the quality of patient care and outcomes, reduce healthcare costs overall, and reduce medication-related adverse events. There's actually been a few studies on the benefits of MTM, one out in Wyoming. I had the opportunity for citizens to meet with a pharmacist for medication review to identify potential medication therapy problems and also focus on costs. And members that were enrolled in that program had an annual yearly savings of about $1,700 per patient. So definitely some cost saving opportunities there. So more specifically with our MTM services at Security Health, we've been providing these services to Medicare Part D members since 2014, and our dual special needs population, or the DSNP population, since 2017. And in this program, there's two primary components or review processes. So the first one is the comprehensive medication review, or CMR for short. We've done about 2,300 of these last year and on track for about 2,500 this year. So this is kind of the big overall review when we go through all things related to your medications, and then more specific, or what's called the targeted medication review, focus on one specific issue. So looking at your adherence, for example, not taking a blood pressure medicine as prescribed, or looking at some other opportunities such as people with diabetes not taking a type of cholesterol medicine called a statin that can help prevent a heart attack or stroke. So those are more focused on one specific issue and happen about on a quarterly basis. So MTM Med Security Health is also provided by our specially trained pharmacists. They're offered at no additional charge to members. Pharmacists will help you get the most from your medicines, lower your risk for harmful drug reactions, find lower cost alternatives to your prescriptions if appropriate and if they're available. Answer any questions you might have about your prescriptions or over-the-counter medications. So the pharmacist will go over all of your medications with you, help identify potential conflicts, can help organize your schedule, ultimately helping to ensure you're getting the best results while keeping your out-of-pocket costs down as much as possible. Some of the disease states we focus on. So we'll discuss anything that your medication that's around, but some of the more common ones that come up a lot are diabetes, high blood pressure, high cholesterol, asthma, chronic obstructive pulmonary disease or COPD, and then heart failure, rheumatoid arthritis, and cerebral vascular disease. This is things like previous strokes. These are all things that come up a lot during our medication reviews. So our pharmacist team internal, we have myself, Amanda, who spoke earlier, and then we also have Andrea Sedlacek, who's another pharmacist in the team here, who will help with our MTM activities. And we also have a partner company called CSS Health. They also assist with MTM activities and have a full team of pharmacists and caregivers over there to help with these services as well. So there's a couple different ways for members to participate. So if they meet these criteria, they'll be automatically enrolled in the program and receive an invite letter in the mail and a phone call from a pharmacy technician inviting them to participate in the program. So if you have 3 or more chronic health conditions that we previously outlined earlier, you have at least 8 chronic medications, and your Part D medicines exceed a certain cost threshold. This changes every year, but as of right now, it's $5,330 annually. And then if members aren't automatically enrolled, they also have the opportunity just to call up the number you see on the screen here. This is our dedicated phone line to our MTM services. So anybody with Medicare Part D can call to request an MTM appointment to do the full comprehensive medication review, or just ask any questions about the program or any questions about their medications that they might have. So more specifically about the reviews themselves. So again, they're phone typically. So you're going to speak in with one of our MTM pharmacists to complete the CMR. So they generally take about 10 to 15 minutes for most people, but some can take upwards of an hour, just depending on how many questions you might have, or just wanted to get some things discussed with a healthcare provider. So we do an extensive review of medications and all your associated health conditions, identify drug therapy opportunities. So these can be related to your medications, or other aspects of your care like overdue vaccines. Then we also look at some potential quality of life improvements for participants. So helping to arrange for in-home blood pressure monitoring or blood sugar monitoring, helping find a pharmacy that's closer to you, or looking at switching some medicines to the home infusion benefit to receive certain drugs at home instead of the office. And then we'll follow up with your providers if care opportunities are discovered. And as mentioned previously, there's also the follow-up letter that includes a written copy of your medication action plan and the personal medication list to keep track of your medications. In regards to the follow-up documents, we encourage you to update this information with your doctors or other healthcare providers every visit. There's spaces on there to add medicines or adjust things change after your review. You can also request additional copies to share with your family or caregivers as well by calling our Security Health MTM line. The next couple slides are just examples of what the follow-up documents look like. So ultimately, it's going to be a several page document is created after the view. This is just a screenshot of the medication action plan portion of the document. So this is a list of the topics that were discussed with a pharmacist, and if there's any follow-up that's needed. So for example, this specific member is on hydrocodone acetaminophen, which is a pain medicine that has a common side effect, primarily is constipation. So we do discuss some over-the-counter options that are available. So your Colaces, your Senas, and your Miralax that they could use if they're having issues with constipation going forward. You go back one more slide, Amanda. There you go. And then the other part is the personal medication list. So this is a screenshot of that. So this will include all your medications. It also includes an allergy list or a side effect list. So medicines you've had reactions to or had difficulty tolerating with or had side effects on will be included here. And then for each medication, it'll be medication name, how it's taken and why you take it, and who the prescriber is. This is a key thing that we go through in the reviews. Be surprised how many people take a medicine and not are exactly sure why they're taking it. So this is a good thing that we include on the documents here, so you have a reference of what that medicine is supposed to be helping with for your health. Lastly, we have a couple success stories for members that participated in the program. First one focuses on a safety concern. The second one is addressing cost. So the first one, when member was taking Entresto, which is a medication you've probably seen commercials for. This is for heart failure. And they were previously taking a different medicine that can help with heart failure called losartan. During the review, the member stated that they were still taking losartan along with Entresto. This combination is not recommended due to increased risk of a potentially serious side effect known as angioedema. So with this issue, you have swelling of the tongue and the throat. So typically it results in at least a visit to the emergency room, potential if it's serious enough, going to the hospitalization to help with breathing. So our recommendation was to stop the losartan and only take the Entresto. So we consulted with the member's provider, and the provider agreed, and the member was able to discontinue the losartan, helping to prevent a possible hospitalization in this case. In terms of cost, we have very in-depth knowledge of the Security Health Plan pharmacy formularies and lower cost options are out there. So this example, a member was taking a non-preferred insulin for the Security Health Part D formulary called Tresiba. So this was a $100 monthly copay during the initial coverage phase, and then that cost would increase further when they entered the coverage gap or the donut hole. So this is the phase of the Part D coverage after your initial coverage period, and you enter the donut hole when your total drug costs, including what you and your plan have paid for drugs, reaches a certain limit, and then it's switched to a percentage copay. So this is why the cost can really balloon for some of the more expensive medicines out there, including insulins previously. So our recommendation for the prescriber was to switch from Tresiba to Semglee, which is also a long-acting insulin product. So after consulting with the provider, the member switched from Tresiba to Semglee, which provided immediate cost savings, as Semglee is a preferred insulin, and the monthly copays were capped here at $35 through all phases of coverage, including the coverage gap. So definitely a significant savings for the member in this case. that's it for the MTM portion of the presentation. So I'll turn it back over to Amanda to discuss our other program, the RX Savings Solutions.
Hi again, everyone. Today I'll be discussing a service that we offer called RX Savings Solutions. My slides like to jump around today. I'm not sure why. So this first slide here, it just kind of a brief overview of the program. And this is a fairly new program that Security Health Plan offers to our members. And so they partner with us, and they have some pretty unique software that can link to our pharmacy formularies and then your unique prescription claims. And what the software does is it helps kind of be a second set of eyes to see if there are any savings opportunities that you might be able to take advantage of. And so the software, it allows patients to create their own online portal login for their individual account, and then that will show any savings opportunities. So we'll go into that a little bit more on these next few slides. And so this is a little bit unique of a service because typically when you think of cost savings and pharmacy programming, you might think of coupon cards, and this is unique in the sense that it's really your individual medicines that it takes a look at, and your prescription claims. So what you're filling on a monthly basis, they're able to take a look at that and really see if there's any and any ways they might be able to help you. And if they do identify opportunities, they actually offer outreach directly to your doctor. So they're able to help facilitate, maybe they found a generic medication that will save you X amount of dollars monthly. They're able to reach out to your doctor to see if, that might be a good option for you. And so a few other examples of what types of saving opportunities they can offer. So kind of talked a little bit about they might be able to look and see if there are generics available. They're also able to help navigate if there are better prices through a different pharmacy. So one example that I see come to mind sometimes is, maybe it's less costly or even maybe more convenient to do a mail order service, so that their software will be able to lay out, what your co-pays might look like at, say, a mail order pharmacy or a different pharmacy that's closer to your house. So they'll display that. And then they can also take a look, say you're on, a pretty high cost brand name drug to treat a condition. They'll be able to look to see if there's any other similar medications that might be just as effective that might save on some cost. So one example they shared with us this year is that they had a patient sign up for the service that had pulmonary fibrosis. So this is a pretty serious disease that causes some scarring in the lungs. And the staff at the RX Saving Solutions, they were able to work with the patient's doctor to switch them actually to quite a lower cost option, saving the patient about $6,000 a year. That was pretty significant, I thought. So just a different way to help with cost savings here. Their service, and they do have dedicated pharmacy technicians that can, really help get you set up and get things rolling. And this slide just has, how more the contact information for the service. So they do have a dedicated telephone line where their pharmacy technicians can be reached, and then they do have a dedicated website here, or also a support email address. So I encourage you to take advantage of this option. If you can, just another way to maybe save on some cost and help decrease expenses. I think we've reached the end of what Kurt and I had prepared. So thank you everyone for attending today. And then I believe we should have some time yet for questions.
Yes, thank you so much, Amanda and Kurt. I did receive a few questions that were submitted in advance, so I'm going to go ahead and ask those. The first one was, I take omeprazole 2 times a day, and I am directed to take it 30 minutes before eating. If I forget to take it before my meal, should I take it later?
So for that one, it's generally best to be taken 30 to 60 minutes before a meal. But if it's hard to fit into your schedule that way, sometimes people are busy in the morning, then you can take it when you remember or a little after a meal, but it just might not work as well. But the important thing is to take it to get that benefit. So you don't want to miss a dose entirely.
Okay. Next question. How much turmeric, and omega-3 should I take? I take one 1,000 milligram turmeric complex with bioperin and two 500 milligrams turmeric with some ginger powder twice a day and 2 ibuprofen at night. This seems to help the arthritis aching in my hands. My doctor and pharmacist have not asked the specific quantities of vitamins and supplements I take. Do you review everything I am taking to make sure my prescriptions and over-the-counter medications all work together? Is that covered by insurance?
So that's a really good question. And my suggestion would to the person who submitted this question would be to sign up for a medication review with one of the pharmacists here at Security Health Plan, and then we'd be happy to kind of go over these things in depth with you. Kurt and I, we did kind of take a look at some of the supplement questions, and in general, about 500 to 1,000 milligrams a day is a typical dose for turmeric. Sometimes it can be dosed higher than that, but then sometimes with that comes side effects. So that's something usually we do take a look at, when we meet with people, is their supplements, how much they're taking in addition to their prescription medications. And I think there was also a question on that one that tied to the how much omega-3s should be taken. And so this varies by age. So generally, if you're over the age of 51, it would be 1.6 grams a day recommended for males, or 1.1 grams for females. And so we're happy to take a look at that more in depth. We just encourage you to sign up for a med review.
All right. A question that we just received. I am transitioning onto a Security Health Plan non-RX plan. Are these services still available to me?
So they would not have the pharmacy benefit. Is that what they'd have, like a supplement plan or something, or is that?
Maybe we'll grab some more information
Okay.
here on that one. While we're looking at that, here's another question we received. I take about 10 pills each day, half in the morning and half in the afternoon. I normally take them all at one time with water. Should I be spreading them out over several minutes?
Generally, it's okay to take most medicines together. There's some medicines that should be separated out from others, and some that are better taken with food or taken on an empty stomach. So again, kind of similar to the last question about the over-the-counter medications, it's hard to say specifically without knowing what this particular person is taking for their medicines, but you can always speak with us at the MTM phone line, or just double check with your doctor or your local pharmacist if anything needs to be separated out there.
All right. I want to circle back to that question. So this person is moving from a Medicare Advantage RX plan to a Medicare Advantage non-RX plan. And we had other information that said that they will be using senior care for prescriptions, but are there, any other options for them to save at the pharmacy other than the GoodRx program, and are they eligible for these two no-cost services that we went through today?
Yep. If anytime or any member with our insurance essentially can call the MTM line and we do a review there. In terms of actual additional cost savings, I think senior care is probably going to cover a lot of that, and the GoodRx as well. Again, we could always look at the person's medication list as well to see if there's any opportunities there.
I hope that that answered this person's question. And if anybody that is listening to this live or after the call has a question, please feel free to let us know. We're happy to get those answers for you. I don't have any other questions in the chat feature or that were submitted in advance, so we can go ahead and close out today's call. Thank you so much, Kurt and Amanda, for joining us and presenting again, coming back. And we will see everybody next year. Be well.
Thank you.
Thank you.
Can I ask, is it possible to see this whole Zoom thing again? Is it somewhere that I can access it on the net?